Okay, good afternoon, everyone. Thank you for joining us for this half-an-hour lunchtime webinar talking about the Arts in Care Digital Arts Programme in Leeds. My name's Amy Hearn and I'm the Digital Inclusion Manager on the 100% Digital Leeds programme. 100% Digital Leeds is a small team working within the City Council and across the ICB, supporting digital inclusion for people and communities that are more likely to face digital exclusion. Today's webinar is about how arts organisations can take part in our Arts in Care Homes, the Arts Participation Programme. This is the second year of us running this programme, and it's an opportunity for arts organisations to be able to offer digital programming or programming with a digital element to arts, to care settings and care residents and people in need of care. And the programme is a way for us at 100% Digital Leeds to offer some engaging digital activity to care home staff and residents who might be digitally excluded because they're particularly lacking in digital skills and confidence. We've found that offering up opportunities for people to engage digitally within something that they enjoy, something that they feel comfortable in, something that's going to give them a nice, meaningful experience, gives people a safe space to feel able to are motivated to engage with digital tools and services so that they can develop the digital skills and confidence they might need to be able to engage with digital further, for the benefit of reduced social isolation, ease in being able to engage with health settings, being able to engage with different types of programming and organisation that's of particular interest to them. So that's what you're going to hear about today. So I'm going to hand over to our first speaker for the day. I'm going to hand over to Alison. Thank you.
Morning all, absolutely delighted to be here with you all. I'm Alison Teeder. I'm the Programme Director for Napa Arts in Care Homes. The aim of the programme is to shine a spotlight on the important role that the arts have to play in care provision. Then our important event is the National Day of Arts in Care Homes, which is now in its 5th year. It's an annual event that takes place on the 24th of September. And this year, to mark 5 years of the Arts in Care Homes programme, NAPA is running an Arts in Care week to talk about all kinds of art forms in all kinds of care provision. And that takes place during the 18th to the 24th of September. Our theme this year is reflections, and we're going to be looking back over the past 5 years, looking at the learning during this incredibly challenging time for both the arts and care sector, and trying to identify what's most needed going forward. And I'll share the link in the chat after my speak, so you can find out more. During the 5 years, we've really seen the important role of partnerships, working in networks, and regional working, and the impact that can have in terms of increasing arts participation in care settings. Thank you to everyone involved at 100% Digital Leeds. I can't wait to see what happens in September as part of your programme. And really looking forward to seeing lots more arts engagement and really shining the spotlight on this really important work. So I'm going to hand over now to Geraldine. Thanks very much.
Hi everybody. My name's Geraldine Montgomery and I'm the executive producer of the Performance Ensemble, a theatre company in Leeds working with people aged 60 and over in the main. Just wanted to introduce that I've been coordinating arts and health networking over the last few years, and in January 2020, Amy from 100% Digital Leeds and I did our first arts and health webinar about the benefits of digital arts engagement for health. The research is still in development because most arts was in person, and it's only since the pandemic that such a lot of arts opportunities have moved online. But what researchers found, such as the Get Creative tests run by the BBC and University College London, is that arts can be a source of distraction. It can take us away from current situations and difficulties. It can be a place of contemplation. It can help us come to terms with things in our life, make sense of the world, and it can be a place of self-development. So it can help us develop self-confidence, skills, and new abilities. All these things are so relevant to people living in care homes who have made sort of lots of achievements in their life, but they're going through a stage of needing a bit of support, needed a bit of care in order to continue their lives, and they're kind of reassessing where they are. And I hope that through this webinar, we can explore new ways to work together. Previously, Leeds Museums, Leeds Playhouse, Upper North, the Swan Song Project, Yorkshire Dance Descendants, Balbia Sing Dance Company, so many organisations of these have come together with care homes to create new arts opportunities for residents, and care extends so much beyond the care home. So yeah, really excited about what comes after this, and looking forward to hearing from Catherine Smethurst at the Care Delivery Service in Leeds. Over to you, Catherine.
Thank you, Geraldine. So I'm Catherine Smethurst, and I work for Leeds City Council Care Delivery Service, and we've recently merged with the skills and reablement teams. So we have a range of services across Leeds, and we are we've been working for some time. It's really apt that that Geraldine was talking about all the work that she's been doing. We've been working. So when I first started, I got in touch with Geraldine, and we were looking at ways of supporting people with better digital access through the period of COVID, when people kind of stuck in their own homes, or they were not able to move from their room in their care home. So I had an idea that we could get people from our services who missed being with other people get together online, and we could also include their carers, that we could connect people in care homes to each other, and we could get our staff teams feeling more comfortable as well with using technology, because it wasn't just the people who were drawing on our services, but it was also the staff teams that weren't that familiar with digital technology. So we started a weekly online wellbeing session, and we called it Wellbeing Wednesday because it's on a Wednesday, and it was a way to get people together and practice using digital technology and kind of re-establish and make the connections that we felt we'd lost with various organisations and groups and individuals, to be able to then make use of those in person as well. So we wanted to be able to get people together, find out a little bit about what their organisations did, and bring them into our services, or bring people out of their care homes when it was possible into those arts organisations. And we've gone through various different transformations with the Wellbeing Wednesday, because we realised that we started having people coming and talking to us, and they do a little talk, and they do a small presentation, and then we found that actually what we needed was something that was very engaging. So the arts were the obvious way. It was about getting people to come and have some interactive discussions, and a kind of show and tell from maybe museums or libraries, to have interactive quizzes. We did chair-based dance, we did exercise, we did music, and then we worked out that what we could do is some hybrid sessions. So I've got a little tiny film here. It's just happened at the care home that I'm in today, and I don't know if Amy can share it to just show people how it works when you've got people in a care home that are doing a lovely chair-based dance session. This is Ascendance, and they're doing their thing with the people. So they've got 9 or 10 people in the care home, and we've also got several other care homes and day services that are joining in. I don't know if you've got that there. Maybe not. Never mind. Okay, so we've just had a wonderful little session where we've seen people dancing and having a really fabulous time, and so then we worked with lots of organisations in a similar way, and what we find is it helps them also to have that little bit of evidence that they're wanting, so that they can go away and they can apply for some funding to do some more work with us, and so the benefits then sort of grow and grow. We've worked with all sorts of people together with arts organisations. We've worked with schools, we've used music, we've used drawing, we've used storytelling. And last year we took part in the Arts in Care. And what we find was we needed to make it as easy as possible. We needed to make it so that the staff in the care homes or in the services, if people weren't able to manage the digital properly, they could just press one button and it was really easy to join in with an activity. And then we worked a lot alongside our staff to get them able to use digital activities and make them live, because that's one of the challenges, is that people see something on a TV and they think it's the TV in the corner of the room, so they carry on sleeping through it or drinking their cup of tea, and that's not what we want. We want people to really be able to engage and understand that they're talking to people and it's live, and make use of that. And we use that, our learning from last year, as the basis of our involvement with the Leeds 2023 Playhouse 1001 Stories. And we worked together with them and did some fabulous kind of human library storytelling back and forth with people in our care homes. And that was, we did some filming as well, which we could share in our services. And that's what it's all about. It's kind of about the access for people, making arts as accessible as possible for as many people as possible. Not everybody can get to an art class, not everybody can get to a dance group, not everybody can join in person. So these opportunities, absolutely fantastic. So I think I'd say really it's about accessible content, making it as easy as possible for people to join in, and having people in the care settings who will encourage participation as much as possible. And now I'm going to pass you on to Lily. Is Lily around?
Did you say my name? Sorry.
I did, yes.
Great. Is that correct? Yeah, sorry, I have a different schedule, but yeah, okay, cool, let's go for it. Amazing. Hello, my name is Lily. So I manage Arts Together. So for those of you who don't know what Arts Together is, it's a network made up of lots of community arts-based organisations who come together bi-monthly to meet, to gather, to talk about kind of what the city of Leeds looks like creatively, to kind of discuss kind of issues around participation, engagement, and then also to celebrate certain moments of the year. So last month it was Refugee Week, and we had a refugee awareness session delivered by Mapwa Theatre, who are one of our partners. And our next meeting in July, which is why this is so beautifully timed, is around Arts in Care Homes Day, and so we are really excited to be able to be working on that and to bring our partners into that conversation, some of whom may or may not have done that work before. So it's really exciting that this opportunity is kind of arisen for us to work on this for September. And as part of kind of my time during this section here is to talk a little bit about something really exciting that we want to do as a network, is to be able to offer some bursary opportunities for arts and community organisations to to be able to have a go at kind of doing this work, whether they've done it before, whether they haven't. So we're looking to kind of offer 4 different bursaries or 4 opportunities for 4 different organisations that will look at supporting things like resources and paying for people's time to maybe deliver this work and to maybe link up with different partners. And we can offer up to £250 per organisation to do something, whether that be a half-an-hour session or an activity as part of Arts and Care Homes Day. And it might also look like working with someone who lives independently and who is supported by a carer. So it doesn't strictly just have to look like being in a care home. So I think we're really open to hearing from different people for different ideas. We're really up for supporting people. I know Jen and the team at 100% Digital are really up for it as well. And we're just really excited as a partnership and as a network to be able to bring people together. And also, if you've not partnered before, this is a really great opportunity to go, I want to apply for that bursary, so I'll become a partner. So please do consider that. I'll send information about how to become a partner over to Jen and Amy after this, and also all the information about applying for a bursary, because we'd absolutely love to hear from you. If this is something you're considering but you're not sure how you can make it happen, please come and talk to us, because we really want to support people to make that happen. I can't remember what time I started, so I'm just going to leave it there and pass on to is it Kathy that's next? Is that correct? Great. Over to you, Kathy. Thanks for having me.
Thank you so much, Lily. Good afternoon, everybody. My name is Kathy Williams. I'm the director of RJC Dance, and I'm extremely proud to share that RJC Dance, based at the Mandela Centre, Leeds, celebrates its 30th anniversary this year. We engage children, young people, adults and elders via dance, movement, exercise and music. In 2020, like many, we were dismayed to hear about the forgotten generation, the elder men, the women in our care homes. We were compelled to do something about this. We applied for funding through Leeds City Council's Wellbeing Fund and named the programme Active Communities. Could we have an image, please? Okay, we employed a tutor, supplied tablets to participants for easy access and support from their carers at their homes, and provided training to further encourage subscription to RJC Dance Adults and Elders online session. To date, we have been delivering a free 1-hour online session every Friday since February 2021 and have delivered 103 sessions to date. Through our innovative work, we aim to raise the profile of arts in care in partnership with 100% Digital. Here are some of the words participants have used to describe how the sessions have made them feel. It's real tonic, cheering, inspiring, invigorating. Other feedback from the participants. It's excellent. I have lost 4 pounds in weight. I think it's from the moving and exercise. It has been wonderful. I look forward to the group and interacting with everyone. The dances are great and the music brings back memories of old times. The teachers are really good and the exercise is marvelous. I don't know what I would do without it. Last year, we were invited to attend the Arts in Care Homes Day, supporting digital arts participation in care homes. Being involved in the programme has enabled us to be part of a movement for change in attitudes towards the elderly and their relationship to dance, movement and exercise, and the digitalisation for the elders. With funding support, RJC Dance will continue to help change perceptions and provide a service for elders in care homes and care settings, supporting the ageing body and mind. We know that movement helps to maintain elements of flexibility into your later years. Working with 100% Digital has enabled RJC Dance to connect to care homes across the city and to be part of a wider reach beyond people in individual homes. Some of the challenges for us for the care home settings have been the lack of dedicated named staff or staff team or activity worker who could work as a conduit between us and the elders. I think it would be really useful for us to have an introduction online or in person with the care homes. So they know the expectations prior to the session. Also, what we found is it's all about sometimes the broadband speeds, because we're using pictures and sound. Sometimes their technology cannot take it. They can either just hear the pictures, see the pictures, or hear the sound. So it's important that they're aware of that. We also need a dedicated space for 1 hour for participants with no interruptions. So we can't have the tea lady coming in midway through the exercise, or, you know, workers or carers who might not be aware of what is happening. So everybody needs to be aware and contribute. So it can't be a thoroughfare. And we also encourage care staff to join in and encourage the participants. And mentioned earlier a large television screen, but again, we are available to go to the care homes in the first instance, talk to the staff, talk to the participants, and, you know, just that, I think that connection one-to-one is really important, and in person. And I think that's where we're at, but it's been great hearing the other speakers. I've been taking down some notes, and I will be connecting with you. And I will now pass on to Jen, I think.
Thanks, Kathy. I think we're going to Natasha just at the moment, and then we'll go on to me.
Fantastic. So I'm just grabbing up one of my slides for you all. Make sure you can all see this. I've lost everybody, but you're still there, so I'll just start. So hi everybody, my name is Natasha. I'm one of the members on the 100% Digital team. I'm going to be talking to you about the support available from us and what we can do to help provide and make your services better and more digitally inclusive. Just conscious that I have only got 2 minutes, so I'm going to talk really quickly, but as all of these, if there's anything that you would like from us, like a conversation, like a chat, like a meeting, stick it in, we're more than happy to. So what's the first point of call? It's about having a chat, it's having a conversation about what you're currently doing for your digital inclusive offer. Have you got a digital inclusive offer? Is there something that we can have a conversation with and talk about other services that are out there, or anything that you're doing at the moment that we can make better and implement in a better way? Some of these could come from funding and different resources. As 100% Digital, we support and we throw out loads of fundings that come our way. You might even see a funding yourself that actually you've seen a bit of funding, you want this bit of funding, but you're not sure how to approach it. This is something that you can have a conversation with us. We can talk about what services you've already got, what is it you're potentially looking to do, how you're going to develop these. And these are the conversations that we can also have with that. But along with that, it's also about building the confidence and the digital skills of your teams. Are they confident enough that they can support your residents? Is there something that we can do to help with that? Are there different courses or different conversations that we can have to help implement digital inclusion and help them understand what it means to be exclusive? With you, where you've got people who are socially isolated, have you got a tablet for them to be able to talk to the families, or other ways of being able to interact and join in different games that you might be doing in the community rooms, but they may not be able to participate with? But is this something that you can include them in with? Other ways is, again, as mentioned, we work with a lot of organisations and partnerships across citywide, really. So is there something that you might know of somebody else that's doing something, but you're not too sure how to approach it? Or you have a conversation with us and say, look, this is what we're looking to develop. What can we do to make this better? Or has somebody else done it as well, that they might have lessons learned? They've done it, they've got guides on it. Is there something out there that might already be embedded that we can help support you on? And then finally, it's just about supporting the digital inclusion to be embedded across your service offer. So have you already got things in place that you might work better with? Have you got family members that are coming to their care homes that you know, they may not have that much data, or they may not have access to Wi-Fi, but this is something that you may be able to provide for them. Have you got enough signposting around your care homes, around these services, about what it is you do? Because a lot of the time it could just be a case of having a little QR code that's on the table that somebody can scan, that can link them to all the different services or the timetables that you might already have in place, that gives them control over what they're seeing as well. So there's a whole stream of different things that we can do, the things and conversations that we can look at, help embed your service already, or help improve and development further down the line. So I realise that I've just spouted off a whole load of information and different options that you may be able to have, you may be able to do, but hopefully it's just get some cogs thinking and different ideas that might be sprouting, that you might go, you know what, that is something that we may want to do and we may want to develop. Let's have a conversation. Let's see how it goes. So I hope that's all okay for everybody. And the next person that I'm going to be introducing is Jan from my team. Thank you.
Thanks, Natasha. Right, so we've heard about the why, and this is the how. So we would absolutely love arts and cultural organisations. It doesn't have to be arts organisations. Last year we had Canal Connections, did a trip down a canal that people were able to dial into from whatever care setting they were from. So if you've got something digitally that you would like to have within our programme in September, which is the 25th of September to Friday the 29th, we would love to hear from you. We have an expression of interest form where you can tell us what you would like to do. If you have any particular audience that you think that your work would be particularly aimed at, or if you think that your work would be appropriate for all audiences in whatever care setting that might be. So whether that's, you know, care homes, but also hospitals, day services, supported living, recovery hubs, hospices, and also unpaid carers working with individuals, with family members or with friends in their own homes. So it might be that you have a particular audience in mind, or it might be that you don't. It might be that you've never worked in digital before, and through this programme we would like to give an opportunity to organisations to maybe test something, to maybe have a go at working across a digital channel if you've not done that before, or to have a go at working with a different audience, to diversify your audience. And maybe you've not worked in digital, maybe you've not worked with people who are recipients of care. And also to build relationships with those care settings, to build meaningful and lasting relationships, just like RJC Dance has done. You know, they've embedded this work within their annual programme. And we know that a lot of the audiences that we would like to reach through this programme are the audiences that are the most hard to reach, are the audiences that are not accessing your work. And we would like to be able to, through this programme, give you the opportunity to access those audiences, but also give the opportunity for those care recipients to access your work. So fill in our expression of interest form, which I will be sending around, but will also be on our website. I'm going to pop my email address into the chat. So in the first instance, please feel free to get in touch with me and have a chat about the work it is that you'd like to do. Have a chat about what support we can offer. As Natasha was saying, there's a place on the expression of interest form to ask for support, and there's also a place on the expression of interest form to offer support. So maybe you are really au fait with working in digital, or you are really confident with working in a care setting. You would like to offer that learning. You would like to do some peer support with other organisations in the city who maybe aren't as confident working in digital or working with this audience. We'd love to hear from you, because we'd really love to get some partnerships going through this, to get some really good conversations, and to get some really, as I said, meaningful work that's got a bit of longevity to it after this programme. So if you'd like to submit some work, have a chat with us, fill in the expression of interest form. And yeah, so I think that's everything. We've nearly come to the end. I don't think there are any questions in the question and answer section. No, there aren't. If anybody's got any questions following on from this, please let me know, and I can get back to you. And also, thank you very much for our panelists for being involved. I really appreciate it. Thank you for all of your passion and your commitment to working with arts and culture, and to be working with recipients of care, and we really appreciate it. Okay, Thank you very much.